Hello everyone, Dr. Drberkkkaratas. Our topic is whether there are herbal supplements or foods that contribute to or enhance erectile function. What can you use? What can you do? I'll briefly talk about these. Recent scientific studies are in the publishing phase regarding erectile dysfunction. Well, in other words, there is very new and up-to-date data in our book because I included this. Now, these are as the name suggests. They can be used as support for treatment, so it's not correct to use any dietary supplement directly for therapeutic purposes. Because we don't know what will happen if they are used for how long and in what dosage. For example, if used for a year, we don't know what will happen if we use 3 milligrams instead of 1,000 milligrams. There are no scientific studies related to these. Yes, there are some scientific studies. I'll explain it shortly. Roughly speaking, the dosages and durations of use become clear. Some of them now, in none of the studies conducted so far has there been a dietary supplement that statistically and significantly improves erectile dysfunction on its own. Such a thing has not been found. There is a dietary supplement. Such a thing has not been found. As far as you know, there isn't any right now. I don't know what will happen in 3-5 years. Now, the issue here is this. Yes, you need to pay attention to this. For example, it used to be a 10 out of 10. It dropped to 6. Sick. That's a serious number. There's a 40% loss. So in masturbation, whether in a relationship or anywhere else, it's 60%. So a 6 out of 10, let's say it's not very meaningful to try to correct this by taking any dietary supplements here, because what happens, it would be statistically meaningless. This is what it means to say that it's statistically meaningless in the studies conducted. For example, it's a 6 out of 10. When you take this, it goes up to 6.1, 6.2, 6.3. So it increases a bit, but it's not very distinguishable. But it would still be the same. These 6 out of 10 can't turn into 8s, 9s, or 10s. In order for this to happen, you need to receive treatment. Now let's see. No, I will definitely use it. So who do I recommend it to, for example? Personally, for example, a 10 out of 10, 9 out of 9, 9.5. There's a bit of stress there. I don't know, you have concerns about life. After that, you're a bit behind sexually. You're a bit less interested in sexuality. In such cases, it can be used for supplementation purposes. It's very serious. I mean, if there's no erectile dysfunction, because there is no erectile dysfunction mentioned there, what is it? The most scientifically studied Korean red ginseng. But it has to be Korean and it has to be red ginseng. What have they done? These dosages are very important, friends. Sometimes, it says there are 500 milligrams in it. Take one a day. Look, it won't help at all. Why? It's not like that in scientific studies because he used it for 8 to 12 weeks. Daily. He used between 1 and 3 grams. He also divided this into 2 or 3 doses. I mean, he used it like 1 gram in the morning, 1 gram at noon, and 1 gram in the evening. Red ginseng has something that the others don't. That's it. The studies are not statistically significant, but in some people. So in terms of firmness like this, they didn't have sizes like 6.2 or 6.8, but they said that in such relationships, satisfaction and happiness don't statistically increase significantly. So there's a yes there. There's nothing on paper, but in terms of happiness, it's a bit more than the others. Only red. Ginseng, there's Korean red ginseng. Another one, Pingnejinol. Sorry. It's hard to say. Of course, it's referred to as pinus. We know it as pinus. For example, this should be taken at 120 milligram a day for 3 months. In terms of duration, pay attention to this. So this herbal supplement is used for 6 months to a year. We don't know what it is, but at least we know this. Most scientific studies are for 3 months. So when 120 milligrams is used for 3 months, no side effects occurred. So it can cause allergic reactions, of course. If it works, it will be cleared in 3 to 5 days. You would stop though. Under normal circumstances, nothing is formed that would cause permanent damage that threatens life. When you use this, I'm saying that you shouldn't use any dietary supplement for more than 3 months. If it's definitely not possible, wait for 6 months and you can use it for another 3 months. You can incorporate it into your life from time to time like this. Tribulus terrestris, here the most important thing noted in the studies is 45%. It needs to contain saponin. This one for 3 months. When you use 750 milligrams a day, that's the thing. The number is 2, 9, and it can absurdly go up to 9.2 or 9.3 lira from that 9. There is a match. There is a match. Lepimedium meni. This is also about 2.5 grams a day for 3 months. It can be used every day. They have individual things like this. By the way, I don't think it makes sense to use them all together. Because we don't know their interactions with each other, I think you can use them one by one. And for example, you can take maca and use it for 3 months. After you stop that, you can start dressing up, I guess. So how right would it be to use them all together? There are scientific studies, but they also contain other substances. I usually tell those who say they really want to use something to get one of these, I say to use one of them for about 3 months, because you get almost the same results with all of them. There's also butea superba. In the first 4 days, 500 mg, then for a total of 3 months, 1000 million a day. They said, for example, using 500 ml for the first 4 days here, allergic reactions may develop. Here, it said that if that develops, at least let's not start with a high dose, let's stop. There's L-arginine. You can't get L-arginine directly from such a plant or from food. It's found in a lot of things. So this is something that can be obtained. This is also about 3 to 5 grams, which is really high for 4 to 12 weeks. 5 grams a day, that's what scientific studies say. Also, take a look at the things you buy. I mean, compare them here. Let's say you need to use 2 grams of Tribulus terrestris, but they sell it in 400 milligram doses. So does it work? Of course. So what happens when you use something like 400? What happens when you use 2000? There's no scientific study like that, of course. We can't distinguish this. But if you're saying that you'll do it in accordance with scientific studies, then these numbers are quite important. Energy is also important. In the latest scientific studies, while I was writing the book, I examined it in detail. In the latest scientific studies, this herbal, it says you can give dietary supplements if you're treating something. For example, you might have erectile dysfunction. You might be taking erectile dysfunction medication. Shockwave therapy has been initiated. PRP has been done. It has become a route. You're using a vacuum and so on. They can be given to contribute to these. It can be given depending on the doctor's preference. You give it. The patient may choose to use it or may not. These are essential things. But if you're going to use these doses and the ages of this group, you can use these doses. If you're saying that you will definitely use dietary supplements, then you can use them. Thank you.